Back here, the government's considering whether to extend border restrictions aimed at curbing the spread of coronavirus. Currently, any foreigners who have travelled through mainland China are being refused entry into New Zealand. The temporary measure was brought in on February 2nd and is due to expire on Sunday. Earlier this afternoon, I spoke to the Director General of Health, Ashley Bloomfield, who has advised the government on whether or not the restrictions should be extended. I asked Dr Bloomfield how the ministry was going, tracking down New Zealanders who had recently returned from China.
Well, the key thing here is that we're seeing an increasing number of people still self-registering, and we're up well over 3,000 folk now who have actually self-registered by calling in through that Healthline number. And we're just still getting on with getting the data back from customs of others who have come in, checking to see if they have already self-registered. And if not, the Healthline are working through that list and contacting people.
So what's the outstanding number of people that you need to track down?
I don't know the exact numbers, but I think the key thing is to see the increasing number of people who are actually self-registering, because that's the biggest contributor to making sure we've got a record of where people are. And as I say, we're well over 3,000 now.
Do you not know that number because you can't tell from the information available to you?
Well, it depends on how many people are coming in each day. We know that probably around 6,000 or just over 6,000 people have come in since the 3rd of February. We've got over half of those who've self-registered. And the really good thing there is that those who are self-registering and the ones that Healthline is following up, people are understanding the obligation around self-isolation and are doing that.
Let's talk about the evacuees who are quarantined at Whangaparaoa. How many people are up there and what happens to them next week when the quarantine period ends?
Sure. So a total of 157 people up there, and 59 of those are nonKiwis, and their planning is well in train now to repatriate them to the countries where they usually live. Once the 14 days comes to an end. So our Foreign Affairs colleagues are very active in that process and working with both New Zealand authorities, of course, as well as the governments in those countries. So once that period finishes, the New Zealanders here, and I'm sure they'll be glad for it, will be able to return to their homes. And then we're making well down the train and making arrangements for repatriating those who are not Kiwis.
What about the New Zealanders who are on that cruise ship, the Diamond Princess? How many are due to return to New Zealand, and are we making any special provisions for them?
Well, I know that consular staff, New Zealand consular staff in Japan, are in regular contact with the New Zealanders there. The two who have been unwell and looked after in hospital, as well as those who are still on the ship. Obviously, that's still quite an evolving situation with an increasing number of people testing positive on the ship. As far as I know, it's still only the 2 New Zealanders who have been confirmed positive, and I know consular staff are in regular contact to ensure that once that quarantine period is over, they can return home.
What are your thoughts on whether there should be any special provisions on their return to New Zealand?
Well, if they have been in quarantine and they're at no risk of having the disease because they haven't been exposed, then they can just come home and go about their normal lives. But we'll be working very closely with the consular staff, and it's a small number of New Zealanders, so we'll be making sure that whatever the circumstances are, that they're followed up if required.
Do you have any concerns about the testing on board, the rate of testing?
Oh, look, my sense is the Japanese authorities are being very prudent about testing, and anyone who's showing any symptoms or may have been exposed to a possible case is being tested. And we're seeing an increasing number of people who are testing positive. I suspect there is an equally large, if not larger, number of people who have tested negative. So it seems to me they've got a very low bar for testing.
But there are reports in other media that only about 300 tests are able to be done at any one time, and some of the people who are due to be released from the ship may not have been tested at the time of their release. Is that safe practice?
Well, I'll just leave that. As I say, I think the Japanese authorities have treated this very, very carefully and very cautiously. I suspect they'll be testing anyone who they think is symptomatic. And that's the same here. You know, we've got a lot of people in self-isolation. We've got some people who there's been a suspicion they may have been exposed, and testing has been done. Over 60 people here in New Zealand have been tested. Those tests have all been negative. So I think that, you know, the key thing here is if people are symptomatic, they are being tested and to rule out or rule in whether it's the COVID-19 virus that's causing them to be unwell.
So the current restrictions on travelling to New Zealand via mainland China, now that's due to expire on about Sunday, isn't it?
Yes, that's correct. So those current restrictions expire on Sunday at midnight, and we've got advice that's gone through to ministers to support a decision around whether or not those current measures get extended.
What advice have you given them?
Oh, I can't preempt the decision by ministers, so they will...
Not asking you to preempt the decision, merely to say what your advice is.
We've given them very good advice based on the evidence and the epidemiology of this emerging situation. And just to reiterate, as I have in my media stand-ups, you know, we're still in a situation, a rapidly evolving and high level of uncertainty. So, you know, our measures to date have been appropriate and precautionary, and we've given good rounded advice to ministers, and I know they will announce their decision once they've considered that advice.
It sounds like your advice would be to err on the side of caution and to extend the ban, given what you've just said.
Let's just see what ministers decide. They've got the advice and they'll announce that.
And that was Dr. Ashley Bloomfield, and the Minister of Health has received that advice, and his office says an announcement about those border controls is expected in the coming days.